Every year at this time, October 15th through December the 7th, we have what's called the Medicare Open Enrollment Period. And during this time, there's a lot of hype from advertisers, primarily insurance companies, and a lot of high pressure from sales agents trying to get you to switch your Medicare plan. Now, frankly, switching a plan sometimes is a great idea, but other times it's totally unnecessary, in fact, a bad idea. To know when to switch or when to stay, what you have to do is you have to avoid all the traps that are set by the advertisers and by the agents. So in this video, I'm going to explain 7 traps that you need to be aware of so you can avoid them. And then at the end, I'm going to show you exactly what matters. All right, so trap number 1 is described well by this common statement we've all heard, that grass is always greener on the other side of the fence. Now, they always say if it's greener, it's because somebody's watering it. But advertisers and agents are always trying to get you to be discontent with your plan you're on, and they're going to try to tell you that, hey, there's a better plan out there. And sometimes there is, but sometimes not. And so what they often will do with this particular trap is they'll focus on maybe 1 or 2 benefits. So they'll say, hey, the plan this year is offering a dental benefit of $2,500. And they may say it has an over-the-counter benefit of $100 a quarter. Now, the plan you're on may only have a dental benefit of $1,500. Over the counter, maybe $40 a quarter. And so they'll focus on these items, but what happens is there's only so many pennies in the dollar that these insurance companies have. So a lot of times they'll reposition and they'll make one benefit higher and they'll take that away from another benefit. And so my point is, what you have to do is we don't fall into this trap. This could be true, but the problem is, where are they getting that from? And so there's usually some place that they're going to minimize the benefit. They don't talk about that. And so what you have to do is you have to look at every aspect of the plan before you really are going to know, is it truly greener over there? And so the way we do that is you want to go to the summary of benefits, at least. Now, there's another way which we can do this, but at least look at the summary of benefits. You can take your present plan's summary of benefits and lay it beside the new plan that you're looking at to really make sure that it's going to be an overall better plan, not just a couple highlighted areas. The other thing you can do, if you really want to dig deep, is you can look at what's called the evidence of coverage. And this really gets into the details, okay? This gives you certainly good information, but that's even going to give you more. But my point is, take the time, because usually the grass is not always greener on the other side of the fence. Now, the second trap that you have to be aware of is the fact that there are dishonest agents in this business. Now, there's a lot of people who are ethical and operate with integrity and really do care about folks, but there's a tremendous amount of agents that really only care about the commission. That's so much concerned about your coverage. And so what they do at this time of the year is they pretend. This is a dishonest agent. They're pretenders for sure. They pretend to be from Medicare, or they pretend to maybe represent the company you're with right now. They pretend to be most concerned about you. And so they're just pretenders. You got to recognize that. And here's how I recognize dishonest agent. Normally is someone that's putting a lot of pressure on you to make a decision now. When people pressure me, I feel like they care about themselves more than they care about me. So watch out when you see a very pushy agent, one that's putting pressure to make a decision. Another thing they'll do is they're going to talk about maybe one plan and one plan only. And so they're going to emphasize that instead of really sharing with you all your options that are available in the marketplace. So again, you've got to recognize these dishonest agents and don't fall into that trap. Now, this third trap is this statement here, thinking that you can get something great for nothing. Now, we all know that you get what you pay for, but what happens with these advertisements, especially that you'll see on TV and sometimes online and through print, they're trying to convince you that this insurance company that's offering you this plan is benevolent. In other words, they're just going to throw all these free things in there because they're so kind and they're so generous. Well, that's really not true. Now, it is true that they are going to give you a free gym membership, right? You can go to your gym for free if indeed you use that and it happens to be a network. And they're going to say, we'll also give you some over-the-counter benefit, maybe $100 a quarter, but some of your over-the-counter items that you typically pay for when you go to Walgreens or CVS or Walmart, those things are now going to be free for you as well. All right, and then they say you can go to your primary care doctor with a zero copay. And again, that is true. And again, they're trying to convince you that they are very benevolent. But what you have have to find out is, yes, those items are free, but are you going to get the MRI that you need, or the CAT scan that you need, or maybe even the PET scan that you need? Well, sometimes they're not so generous when it comes to those items because those have to be pre-approved. Are you going to be able to go to the doctor that you would like to see if you happen to get cancer? Are you going to get to stay in that skilled nursing stay beyond the average 21 days or not? So the point is, yes, they're going to give you a few free items, but you have to find out, are they really benevolent? In other words, how is your insurance going to work? And so don't fall into this trap that there's going to be something great offered by the insurance company and there's no cost to you at all, because there is a cost. There's no cost here, but there is a price to pay with some of the pre-authorizations and different aspects of that Medicare Advantage plan. So be cautious with that trap. All right, that brings us into trap number 4. And this is for people that are saying to themselves, I'm healthy, so why would I spend premium dollars on a supplemental plan? And so the problem with that is typically this is someone that is turning 65, so they're going to make a Medicare decision at 65. They may rarely see a doctor, or they may not even take any medications or very few medications. And so what they're doing, they're thinking about now, just right now. In other words, they're not really thinking about the future. What they're thinking about is premium dollars only. And so they say, hey, just give me the cheapest plan that's on the market. I don't go to the doctor. I don't take any medications. And so what we fail to realize is that our health can quickly change. You may be healthy now, and frankly, I hope you are, and hope you stay that way the rest of your life. But I've had plenty of clients that were healthy at 65, and then they turned 66 or they're 67, and now they've been diagnosed with cancer, a serious cancer. And so now they're in a position where they would love to have a supplemental plan, but they can't get one. They'd love to have a supplemental plan so they can go to any doctor that they would like, so they don't have all these out-of-pocket expenses as they would on an Advantage plan. So you can't just look at your present health to make the decision. You have to be concerned about, what is my insurance going to look like in the future? And that's why some people go ahead and get a supplemental plan even though they are healthy, because they don't want to take the risk of not having great insurance if something were to change in their health. All right, now trap number 5 is the mentality of, well, I can always switch at a later date. Frankly, this is a trap that people who are misinformed oftentimes fall into. And so what I mean by that is this: you can't always switch later. Now, it is true every year, October 15th through December 7th, as well as January 1 through March 31. If you're on an Advantage plan, you can switch those Advantage plans, but you can only switch to another Advantage plan unless you're healthy and can go through underwriting. All right? So it is true, we can switch Advantage plans. The problem is when people are on an Advantage plan and then they would like to switch to a supplemental plan, and let's say they've been on an Advantage plan for a year, 2, 3, 4, 5 years, some length of time, and now they want to switch to a supplemental plan. Typically, it's because now their health has changed, they've been diagnosed with something, and now they're concerned about their coverage, they're concerned about their network and all the issues that surround an Advantage plan, and now they want to make that switch, but now they can't, because why? To make the switch, now we're going to have to ask you 25 or 30 health questions, check all your medications, get a statement from your doctor, and that information then is given to the supplemental company, and if they like your health situation and your pre-existing conditions, they will approve it. But if they don't like it, they absolutely can deny that coverage, except in New York, Connecticut, Maine, and Massachusetts. So all the other 46 states, as well as the District of Columbia, you're going to have to qualify to get off the Advantage plan and move to supplemental plan once you've been on that Advantage plan for a year or longer. All right? And so we've got to be aware that we cannot just simply switch later because now our health has changed. Okay? You're misinformed if you believe you can do that. All right, that brings us then to trap number 6. Now, this is the trap that people, I would just call them the hopeful. In other words, they hope they're making the right decision. And typically what happens is they look at Medicare and all their options, and they get confused, and they kind of just throw their arms up and say, hey, I am just going to get the plan that my neighbor did, or I'm just going to get the plan that my coworker did, or that my brother-in-law got. In other words, what they're doing is they're simply going to copy someone else. And so I would encourage you, don't fall into that trap. You're an individual. You take different meds than your neighbor does. You have different doctors than your brother-in-law does. In other words, your health situation, your risk level is different. You have a different budget, so you're just different. And so you want to find something that is specifically designed for you. So again, don't fall into that trap. trap. Don't copy someone. Why? Because it could be that that was a great plan and a great decision for that person, but it could be a lousy one for you. So take the time to, number one, understand what you're doing, and then secondly, look at those options and make a plan that's going to be best for your particular situation. Don't fall into this trap. Hey, if you found this video helpful and you want to see more Medicare information just like it, then go below, right below the video, and you can give us a thumbs up as well as subscribe to our channel. And every time I put a new video, which is about 2 every week, you'll be notified of that video, and others just like you who need this vital information will get it as well. All right, that brings us then to the 7th and final trap. And then after this, I'm going to show you what really matters, okay? Because we want to make sure you avoid these traps. But trap number 7, very common. This is people that are new to Medicare and they say to themselves, well, I can just figure this all out by myself. In other words, I don't need any assistance. I think this is something I can do on my own. Now, the truth is, in my opinion, that's just someone who really is naive. Folks, I've been in this business 15 years now, and I've written tens of thousands of cases. I've seen almost everything there is to see in Medicare, but you know what? I don't know it all. I still continue to learn things about Medicare because Medicare is an evolving program. And so it doesn't mean to say you're not smart enough to do this on your own, but if this is your first time in Medicare, there's a lot of moving parts. It's very difficult sometimes for people to connect every piece of the puzzle together because there's a lot of pieces to the puzzle, all right? And so it's dangerous to do this. And by the way, to get assistance from someone that really knows what they're doing doesn't cost you any money anyway. So a lot of times people, I'll do it by myself because it's going to save you money. You will not save a penny. It could cost you drastically if you make a bad decision. So again, I don't think this is wise to do because you have others out there who could assist you. I can assure you, if I had to go to court, I'm not going to represent myself. I'm going to get an attorney to represent me. And so the point is, there are people out there that are professionals, that are experts in this field, that you can have them help you and assist you to walk you through this step by step. And if you find someone that cares about you, they'll lead you in the right direction so you can find the very best plan for your specific situation, and there's no cost at all to get the agent's help. So again, don't fall into this trap. Get some assistance. All right, now let's talk about what really matters. All right, so we've seen the traps, and now let's talk about how to avoid them and really focus on what matters most. Number one, what you have to do is get educated first. Before you fall into the trap, the advertisers and the agents and all their hype and all their pressure, don't do that. Take a step back and really get educated first before you make any kind of enrollment decision. Now, really, the first thing that you have to understand as you get into the Medicare system to get this education, folks, is there are 2 systems that are available for you to use when you're going to use and go on Medicare to use your Medicare benefits. One of those systems would be to enroll in Medicare A and B. You add a gap plan or a Medigap plan called a Medicare supplemental plan, and then you also add a prescription drug plan. Now, this particular option, these kinds of things, this system is when Medicare is going to be the first payer. Medicare is going to make all decisions along with the doctor, and then you have a private health insurance company to fill in the financial gaps. That's their role. And of course, we have to pay a premium for that kind of coverage, but with that comes a tremendous amount of benefits as far as how your insurance is going to work. Now we have to add a drug plan. Drug plans in most zip codes are anywhere from 15 to 25 different options, and so we pick a drug plan based upon the medications that we take and the pharmacy that we would like to go to. All right, so that is one system. The other system is called an Advantage plan. Again, we still enroll in A and B, and that's what you'll see in both of these systems. They have in common. We have to be enrolled in A and B, but instead of using A and B now, what happens is I'm going to use now a private health insurance company. These are called C plans, or also called Advantage plans, all right? Now, the only thing that these 2 systems have in common, I've got to be enrolled in A and B, which means I have to pay my Part B premium. This year, that's $164.90. That's 2023, 2024. This went to $174.70, but we've got to pay our Part B premium to either have a gap plan or an Advantage plan. But the thing is, these 2 systems are different, all right? And so you have to evaluate those differences. This system up here with my gap plan, what am I doing? I'm paying a premium for that coverage. But what I've done is I've transferred most of the risk of my healthcare out-of-pocket expenses to that insurance company. So they get the premium, but now they also are the ones that are assuming the risk. So what I've done, I have transferred that risk away from me to them. All right. Now, when I take an Advantage plan, what happens is I typically have a zero premium other than my Medicare. And so what happens now instead of transferring the risk, I'm going to assume the risk of my copays. I'm going to assume the risk sometimes of co-insurance, sometimes the deductible, up until the annual max out of pocket, which on average HMOs are about somewhere around $3,000 to $4,000, PPO somewhere between about $4,000 to $7,000. So I don't pay a premium, but I still pay, but now I'm going to pay as I go. And you just simply have to decide which one of those systems is going to be best for you. Now, one of the issues about supplemental plans that people really like is here, I have no networks. I can go to any doctor that takes Medicare. If I have an Advantage plan, I'm either going to be in a network that's called an HMO or I'm going to be a PPO. If I'm in an HMO plan, I've got to stay in my network unless it's emergency, and I have to have a referral to see a specialist usually. If I'm in a PPO, I can go out of the network, but it costs me more money to do that. And so again, that's the difference in the two systems. Secondly, if I'm on a GAP plan and Medicare is the primary payer, your doctor, Medicare, make all the decisions. That GAP plan says nothing. If Medicare pays, they have to pay based upon the supplemental plan that you bought. All right? And so if I have an Advantage plan, that's not the case. What happens here is about 70% of the healthcare services that you will need are going to require pre-authorization. That means that your doctor does not have the final say-so. The insurance company has the final say-so. Now, sometimes they approve pre-authorizations, but sometimes they delay them for several weeks or maybe several months, or sometimes they just flat deny them. Say, no, we don't believe you do need a knee replacement or hip replacement. We believe therapy is sufficient. We believe that you can go home from the skilled nursing facility after 19 days because that's what our artificial intelligence is telling us, not the doctor. All right? And so the point is, it's a different system. Here, the insurance company has some say-so, can interfere sometimes with coverage and health care that you really do need. Up here, that can never happen, but that's what you have to decide. All right? And so the point is, you have two systems, so be sure you're educated about them. And again, you're not going to get educated through a little 30-second blip on TV, or even educated typically by agents who are trying to pressure you into making a decision on an Advantage plan. But get that education first so you can make a well-informed decision that you'll be happy with for the rest of your life. And the second thing you have to be educated about when it comes to these two systems that we just talked about is, number one, when you start Medicare. Folks, when you start Medicare, and again, that may be at 65 and maybe 67 if you continue to work and are covered by a group plan. But what happens is this. When we start Medicare, we're going to enroll into A and B, but the key date here is our B date. So let's say someone is starting Medicare 1/1/2024. Now, let's say they're 67 years old. They may start their A date earlier. They actually may have an A date of 1/1/2022. And they enrolled into A only, then they retire and picked up their B. But this B date is a key date. And that's why I'm educating you about this, because now what happens is in 46 states and the District of Columbia, you now have a window of time of 6 months, which is called your Medigap Open Enrollment Period. It's also called your Guaranteed Issue Right. Those are synonymous. And so what happens based upon my B date in this example here, I have now 6 months where I can get any Medigap policy, any letter that's available to me that is sold in my state, any carrier that you can choose from, and there's no underwriting during that 6 months. Now, frankly, you can apply 6 months in advance in most states, sometimes 3 months, but I can apply in advance so my Med Sup plan starts on my B date. But this B date here, what it's teaching us, or what I'm trying to teach you, is that we have 6 months. So I can do it 3 to 6 months before, but once the B date starts, now my 6 month window, that clock begins to tick. So in this example, this would be January, February, March, April, May, June. Okay? Which means now, in my example, July 1, 2024, in every state but 4, if I want to get a supplemental plan beyond that 6 month window, now you have to medically qualify. We're going to have to ask you 25 or 30 health questions. Check your meds you're taking to see what you're being treated for or have been treated for in the last 24 months. Get a statement from your doctor. And all that information is given to the supplemental company. And now they have the right to say, no, we're not going to approve the policy. But during the 6 month window, they don't have that right. They absolutely have to approve your policy regardless of pre-existing conditions. So be sure you're educated about that as well. Now again, we said the other system was what's called Advantage plans. Advantage plans. C plans, replacement plans, private health insurance companies that replaced original Medicare for you. Now, these never have health questions. You can always get one of those. But what happens if I take that Advantage plan and I stay on that plan a year, 2, 3, 4, 5 years down the road? Now I want to get off and I would like to move up to that supplemental plan now and beyond that 6-month window. And now you're going to have to medically qualify to do that. So as we get educated, we want to make sure that we're starting with the right plan and we understand the rules for switching. Hey, if you come to a place where you know you're going to have to make some Medicare decisions pretty soon, the best way to do that is to click up here in this right-hand corner and you'll have an opportunity to be able to book a call with one of our Medicare guides. All the guides around here I have personally trained, and they truly are professional. They'll answer your questions and they'll show you different Medicare options to make sure that you're confident in the decision that you make. All right, the second thing that really matters most, and I want you to know about this so we can avoid the traps, is to be sure, notice this statement, evaluate all your options, all your options. Not just one, not just the other, but all of them. Now, a lot of agents who, again, are pushy, who are focused only on commission and not your coverage, sometimes who are dishonest, all they want to talk about is what? Advantage plans. Why is that? Well, because Advantage plans pay us a much higher commission. We make twice as much money on Advantage plans on that initial commission, and we have lifetime residual income on Advantage plans. So now you can see why agents push those. But that's not fair to you. You need to make sure that you evaluate all your options. So what's going to happen? The first thing we're going to look at is we're going to look at subs. Right? Those Medigap policies. We're also going to look at the C plans, right? Because sometimes that's a very good fit. But we're going to look at those plans. And what you have to know about supplemental plans is they are what we call standardized by Medicare. Standardized. That means if you get a G plan or an N plan, the two top plans right now, the rules for what bills are paid and what bills are not paid, those rules are established by the government. Insurance companies sell those to you, make those available, but they don't set the rules for what bills are paid or not paid. The insurance companies Medicare's already done that by standardizing the plan. Here's my point. If you take a G plan and you get that from United Healthcare or Mutual of Omaha or Aetna, or you get a G plan from Humana or from Cigna or from Anthem Blue Cross, whoever, that G plan is going to pay. All those carriers are going to pay the same bills. There's no difference in coverage. If I get an N plan, no matter, again, who I get it from, it doesn't matter. The coverage is going to be the same. And so that's what we mean by standardized plans. So a G is a G is a G is a G. An N is an N is an N is an N. They're all going to pay the same bills, so we don't go with one carrier because we think we're going to get better coverage versus another. That's not going to happen. So number one, they're standardized, but number two, what we care about is what is that initial premium? And sometimes the company that has the lowest price could be the best. But it's not just the initial premium that I look at. I also want to look at the stability of the rates. All plans are going to go up. They just do. They will go up in price. But some companies tend to take more frequent price increases and more drastic price increases, which means what? They're not stable. So when we write a supplemental company, we're going to look back at the 10 years of history of the premium increases, and we want to go with a carrier that is more stable. Typically, that's going to be a national carrier, one that has more policy holders in your group. Why? Because then that risk is going to be spread out to more policy holders. Okay? I always use this illustration. Forgive me for repeating it, but if you've never heard it, I think it's important to note. When we talk about stability of rates, what matters is the market share that company has in your particular market. In other words, do they have a lot of policyholders in that group or not? And so if I have a small group, what happens is kind of like being in a canoe in an ocean. I'm in a small boat and a big body of water. And I guarantee in the canoe, you're going to feel every single wave that hits that canoe. And that's the way it is if you're in an insurance carrier's group that does not have a lot of policyholders. If there's a lot of health problems in there, you're going to feel the pain of that through price increases. Now, if I am with a large carrier, more of a national carrier that has a greater market share, it's kind of like being in the big ocean, but now I'm in a cruise ship. I'm on a cruise, and I've been on those, and I know what happens. You hardly even know you're in the ocean. You don't feel the impact of those waves as a general rule. And so why? Because it's a big boat, big body of water, less impact. And so that's why we care about stability. Yes, I care about the initial initial rate. Sometimes that could be the same company offering both of those, but we don't just look at initial, we also look at the stability of the rate. So we want to be sure that we evaluate all of our options, not just pressing one company. And that's why we're brokers, frankly, because a captive agent works for one company and only one company. A broker like us, we're going to write for multiple carriers. All right, now when it comes to C plans, as we talk about all of our options, we know that we're going to have to make a decision. Are you going to be on an HMO or a PPO plan? There's difference in amount of providers and hospitals and doctors that are going to take those plans. And so then we want to look at also all of our copays. Now I know the insurance companies want to advertise everything that they provide at zero, but not everything is going to be a zero. You're going to pay for a daily rate to go to the hospital. You're going to pay for a scan. You're going to pay for an outpatient procedure. You're going to pay as you go. So we want to make sure that we know about the copays. We also want to make sure that we know about our max out of pocket for the year, because that's going to reset every January. And then we want to make sure that that drug plan that's included, that we've got great coverage for our medications. So when we make the decision, we've got to consider all of these things. We're not going to focus just on one or two little items, as sometimes agents would do. We're going to focus on the entire plan to make sure we're going to be happy with all of that plan if we go on it. All right, so these are the things that you've got to be educated about, and then you want to evaluate every single option that you have. All right, we'll close out with this one. I think this is very critical, folks. So number 3 is this: be sure that you enroll with the help of an expert. We've already said that when you use an agent, you do not have to pay the agent at all. Why? We don't work for free, but the insurance companies pay the agent. And this is the way almost all insurance works. Your auto policy, you didn't pay a commission. The insurance company did. That's the cost of them doing business. A homeowner's policy, same thing. Again, the agent's paid by the insurance company. So when you have an agent assist you, there's no cost whatsoever. Plus, the premium that you pay is the same. Let's say that you decide you're going to go with United Healthcare and you call them direct, and their premium's $125 for a G plan, $90 for an N plan. Or you call us or someone like us. The premium's the same. We don't establish the premiums, the insurance company does. And so the G plan's going to be the same price, the N plan's going to be the same price. So there's no difference whatsoever. Plus our services are going to be free. All right, so how do you decide who is an expert? Let me just give you a couple tips and then we'll close out. Number 1 is this: you want to find out, are they experienced? What kind of experience do they have? Folks, what I've learned about this business, I've been at 15 years, it is very easy to get an insurance, but it's very hard to succeed. But you want to work with someone that has some experience, not someone that's a rookie. Rookies just haven't seen enough cases, have not dealt with enough people to really give you credible and reliable advice. So someone's experienced. Ask them, how long have you been in the business? How many clients do you have? How many people have you served? And if they'll be honest, you ought to be able to evaluate whether they really do have the experience, okay? Now, I will tell you another thing, too. You can ask them, hey, can you help me enroll into A and B? Is that something you can show me how to do? And I can tell you, if they're really experienced, they'll probably say yes to that. But they're rookies, they say, no, you'll have to take care of that on your own. Or you could say, hey, can you help me with the drug plan? They'll say, no, you're going to have to take care of that on your own. Whereas they don't have the experience to really walk you through that process. Okay, so that's number 1, someone that's experienced, someone that maybe a friend of yours worked through. What do you have as far as referrals go? Can you tell somebody else that has used your services? But evaluate the experience. And then number 2, you want to find someone that is honest. Now, I know this is difficult to evaluate, but there's a lot of things you can do online now to evaluate the honesty, the integrity of the company, of that agent, star reviews, those kinds of things. But you want to do all that you can. I know everyone's going to tell you they're honest, but there ought to be others that can tell you that they're honest. I mean, we all brag about ourselves, but are there others that are really bragging about them and giving them good reviews online to make sure you're dealing with someone that's honest? And remember what I said earlier about someone's honest. We'll talk about all your options. There's no pressure from them. They're not going to talk about just simply one plan. They're not going to hype something up and not tell you about all the aspects of the plan. That's how you recognize someone that is honest. And then number 3, I think an agent who really is an expert is going to do this. They are going to give you the time that it takes. If someone's rushing through a sales call, rushing through a presentation, and not giving you the time for you to really get your questions answered, to make sure you have the time to make sure you really understand how this plan is going to work. Sometimes people just want to rush you through the process, do a quick enrollment, typically an Advantage plan, and so they can get on to the next person. That's just what they do. And so, again, I think someone who's an expert will give you the time to make sure you're comfortable with your decision, with your options, so that they'll know and you'll know that you have made the best decision for your particular situation. Okay, so again, that's an expert. And then lastly, you want someone that is full service. Again, full service. Folks, anyone can write a plan, hang up, and then never talk with you again, never make themselves available to you again. In fact, frankly, that's the norm. That happens a lot, especially with call centers, all right? And so full service. And by the way, we do lots of business over the phone. We're not a call center. You actually have your own agent, full service. And so full service means what? It means this. They will enroll you into A and B. We do all day long. We also help people with their Social Security if they want to tie in their Social Security decision with that Medicare decision. All right, and so full service. They also have a customer support team. Frankly, this is one of the most frustrating things for me as a broker that's been in this business for a long time. What a lot of the insurance companies do today, and certainly agents, is they just say, hey, call the 800 number. And what happens when you call the 800 number? You're typically transferred overseas somewhere to China or India or the Philippines. And sometimes you can understand those people and sometimes you can't. English is their second language. That's a problem at times. Also, I've had some communication with some of these call centers, and I often wonder, well, who trained you? You don't hardly know anything about Medicare. And yet these insurance companies who make billions of dollars are sending you overseas to these international call centers where they can pay those people pennies and they're responsible now to take care of you. That's frustrating. And so what we do, we've invested in a customer service team that is U.S. based. I've trained every single one of them, and we offer our services to you. Any problem you have, you call us. That's what I mean by full service. So not just are you going to enroll me, but where are you going to be if I have a claim problem or some kind of change I need to make my plan? They're going to be available for you in case things happen in the future. And so here's the deal. You want to make sure that you enroll with the help of that expert, someone that knows what they're talking about, someone that's been in the business for a while, someone that puts no pressure on you, gives you the time, helps you with everything you really need, A to Z. That's when you'll know you found an expert.